Okay, which seems like we are live. So if I may call the meeting to order. Very good. We've started, by the way. Okay, good. Thank you very much. Well, thank you everyone for coming. Very good to see so many people here joining us. Welcome to tonight's meeting. My name is Councillor Nikos Souslous. I am the chair of the Social Inclusion and Community Safety Policy and Accountability Committee. Before we start, just a few housekeeping points. The meeting is being live streamed to the Council's YouTube channel, and by participating, you are consenting to being recorded. If the fire alarm sounds, we will adjourn. We'll leave in an orderly fashion by the fire exit, which is behind me to the right over there. We don't expect a fire alarm exercise today. There's tea, coffee, and biscuits available in the kitchen, again over there, and we'll probably be taking a 5-minute break between the items just for housekeeping purposes. And when you first speak for the first time, if you could introduce yourself and if you make sure to speak into the microphone. Right, we might as well proceed with the agenda. We have apologies from Councillor Dinsmore and then declarations of interest. Do we have any declarations of interest from anyone? No, very good. And then minutes, we need to approve the minutes of the meeting on the 20th of November and the 4th of February. Do members agree the minutes as an accurate record? Yeah. Okay, thank you very much. In that case, we move on to our first item, which is item number 4, violence against women and girls, spotlight, and we had the papers, and I would like to invite Annabelle Moores, who is our violence against women and girls lead, to introduce the report.
Hi, thanks for having us here today. As you said, I'm Annabelle. I'm the Ending Violence Against Women and Girls Strategic Lead. I work really closely with my colleague Katerina, who is the Violence Against Women and Girls Programmes and Partnership Lead. And we also work really closely in partnership with our service providers, 2 of whom are here today. And we have one person who's running slightly late, so she will be joining us shortly, just having some problems with public transport. Before we start, I just think it's really important to recognise that violence against women and girls is an emotive topic, and given its prevalence, most of the people in this room will have either been directly affected or will know somebody who has. So I'd like to encourage people to look after themselves, and if you need to step out and take a break at any point, then please do. Help is available, and we will be discussing the support that is available in our borough to victims and survivors of violence against women and girls as we go through this presentation. In Hammersmith and Fulham, we've always been champions of innovative best practice responses to violence against women and girls. We were the first borough in the UK to adopt the coordinated community response model back in 1997, still considered best practice and cited as an example of a whole system response in the government's Tackling Rogue Strategy 2021. We also have the only best practice specialist domestic abuse court in the country, and our Vogue service models are again examples of best practice, including the consortium model of the Angeli Vogue service, delivered by 6 specialist providers, and the co-located independent domestic abuse advocate service. In recent years, we have reaffirmed our commitment to ending violence against women and girls, and stopping violence against women and girls in all its different forms is a H&F Labour manifesto commitment and a priority for the Council. In 2022, we published our first independent Ending Vogue strategy and appointed a sovereign Ending Vogue lead. Since then, the Council has made significant financial investment to expand the Vogue team and enable us to deliver against our Vogue strategy and the accompanying action plan. Most recently, the Vogue team have successfully secured an additional £250,000 per annum of core council funding to continue delivering our vital Vogue services. Our Ending Vogue strategy outlines our 4 key objectives. Vogue is prevented, survivors are supported, abusers are held to account, and collaboration to create change. In the last 12 months, we've been working with the H&F Youth Council to develop a series of podcasts made by young people for young people to raise awareness of healthy relationships, positive masculinity, and sexual health and consent. You may have seen digital comms around the borough promoting the podcast on BT Links, at Westfield, and on the big screens at the Levat Shopping Centre across the road. In addition, we were the first borough to introduce a borough-wide street harassment PSPO, raising awareness of one of the most pervasive forms of Vogue that women and girls shouldn't be subjected to, but disproportionately are. Again, you may have seen the No More Sexual Harassment street stencils across the borough near major transport hubs and on the high streets, sending a clear message that we won't tolerate that behaviour in H&F. Every year during 16 days of activism, we also deliver a robust programme of events alongside partners to raise awareness of VOG, to upskill professionals and empower individuals to speak out against these abhorrent forms of abuse. We commission a wide range of services to support survivors, and my colleagues who deliver these services will tell you more about why their services are so effective in responding to the intersectional needs of survivors. My colleague Katerina will also talk to you about the robust refuge offer we have in Borough for people fleeing domestic abuse, including 2 specialist refuges, which are the only ones of their kind in the UK. And we believe that abusers must be held to account for their behaviour and provide opportunities for behaviour change. Our Children and Family Services have adopted the Safe and Together model, working alongside the non-abusive parent and challenging the behaviour of the person causing harm. Since 2022, we've also introduced 2 perpetrator programmes after successfully applying for Home Office funding. The DRIVE model works with high harm perpetrators of abuse, and the Culturally Informed Family Approach is a programme available in 20 languages, focusing on integrated victim safety support, one-to-one perpetrator delivery, adult-to-parent familial domestic abuse, LGBT+ delivery, and outreach work. Collaboration is key, and we work closely with a broad range of partners to deliver our strategy to ending the VOG, ending violence against women and girls, including children's services, adult safeguarding, public health, housing, the police, and of course our specialist providers. It's a core component of the coordinated community response. Everyone has a role to play, and VOG is a cross-cutting issue that affects all of us. We understand that every person's experience is individual to them, and that people will have intersecting experiences of abuse and discrimination, so we adopt a person-centred approach. We've built and continue to develop a system that supports all residents and a diverse community of people living, working and visiting here. And I'd now like to pass over to my colleagues to talk about the services that we provide and commission in H&F. I'm going to start with my colleagues from Advance, and I'll let you introduce yourselves. Thank you.
Thank you very much. Liz, if you'd like to.
Thank you. Thank you. Hi, everyone. My name's Liz Mack, so I'm Chief Executive of Advance, and I'm here with my colleague Amy. I know you'll introduce yourself. So Amy Glover's Director of Services for our domestic abuse delivery. So Advance are an organisation that work to deliver domestic abuse, specialist domestic abuse provision in the community across some London boroughs. We also work with women in the criminal justice system and recognise the need for specialist delivery with young women and girls. That's us as an organisation. But I think we were invited here today to really talk about the Angelou project, which is part of a broader picture of the response to VOG in the local authority. And I know our colleague Sally from Standing Together Against Domestic Abuse, who interestingly are a sister organisation founded by the same founders 25 years ago, we'll talk more about the domestic abuse court and the kind of impact project. So that's which we work together on as well. So Advance are an organisation that are delivered for women by women. We provide practical and emotional support wherever and whenever a woman or girl wants it. And really one of our key values is about amplifying the voices of women and working in collaboration. Sorry, we're on slide 3, I think. Thank you. Next one. Thank you so much. So this year we've got the exciting opportunity to celebrate 10 years of the Angelou service, which really is the realisation of that collaborative vision that local authority colleagues have described. You know, the willingness and curiosity to really listen to the voices of the community and to women has enabled the Angelou project to thrive in a way that really meets the needs of the community best. And I think that wouldn't be possible without that genuine collaboration and visionary approach from colleagues around the room. So the Angelou service is an innovative, culturally dynamic partnership model which provides single front door to specialist trauma-informed support for survivors of violence against women and girls. And really contextually, just if you could move to the next slide would be wonderful. Thank you so much. In 2015, a review across Hammersmith and Fulham, Westminster and the Royal Borough of Kensington and Chelsea identified some gaps in the needs of women, in that really knowing that women who are experiencing violence needed specialist services run by and for their own communities, and that really VOG needed an intersectional response. And one that's an accessible service for women and all their needs. And the Angelou partnership was formed to address those. And so fast forwarding to 10 years down the line in 2025, as Annabelle spoke about, there are 6 funded partners who we'll talk you through in a minute, commissioned by the 3 boroughs to offer holistic support to survivors of violence against women and girls, and 4 unfunded partners who offer added value, insight and expertise in their specialist area of knowledge. And this slide just gives you an oversight of the partners who are involved within the partnership and kind of what their distinct arms of delivery involve. And I know you'll talk a bit more about that, Amy, so just quickly to give you an overview of the service model before I hand over to Amy to talk more in detail about the model. There are 12 advocates who work across the borough, the service, and that presents a single point of access and a shared referral process. So really making sure that women don't have to tell their stories twice. And that no matter which front door they come to, they get the right service to meet their needs. Specialist workers within that are Black and minoritized survivors, services which specialise in harmful practices, LGBTQ survivors, young women and girls advocates, specialists in sexual violence, mental health and substance use specialist IDVAs. I think that's handing over to you. Thanks, Amy. I'll turn my mic off.
Hi, everyone. So yes, as Liz said, my name's Amy. I'm the Director of Services for Domestic Abuse at Advance. So just to talk a little bit more about why Angelou is so unique. So Angelou is a specialist buy and full partnership. So we have, as mentioned, 6 partners who are funded, but 4 unfunded partners. By working together as a partnership, what that enables us to do is offer one front door, one referral pathway. A survivor can come to any one of our organisations and get triaged into the right place. It avoids women having to repeat their stories. We know that's re-traumatising for people. It makes things easy. It can be really overwhelming and daunting trying to work out how to get support. We have a website, has very clear phone numbers, one email address. It's very easy to reach us. Beyond that, we can offer a coordinated partnership response. So we upskill each other. We meet as a partnership regularly. We can problem solve together. We can share trends that are emerging. We can talk about how to manage referrals together. And overall, that makes us much greater than the sum of our parts. And really importantly, we can ensure that we're working from the same shared ethos and values, and of course, ensure that those are aligned with those of LBHF. So next slide, please. So just to briefly talk about some other services we have in LBHF. So also commissioned by LBHF, as Annabelle mentioned, is our co-located IDVA service. So we have advocates. So IDVAs, for those who don't know, stands for Independent Domestic Violence Advisor or Advocate. We have advocates in housing, in children's social care, and in criminal justice. The criminal justice IDVA is also part of our wider approach involving the specialist domestic abuse courts. They're based with the police and in the court, and Sally, when she arrives, can talk more about that. The massive positives of having these is, again, about offering that coordinated response to domestic abuse. So in those co-locations, our IDVAs will offer upskilling to housing and children's social care and police staff. They'll offer training. They also offer consultation. So where people may not have consented to a referral, we can sit down with professionals and still talk them through how we would address that case and how we can support that person, even if we cannot work with her directly. Alongside that, we also have a huge number of services at Advance that works with LBHF residents at no additional cost to the council. So these are sources of funding that we've found elsewhere for different parts of our work to make sure that we can offer the best support possible to residents. So I won't go through all of these in detail. As you can see, there's a lot of them. But the notable ones are our Step Down and Recover service is a grant-funded program that offers support to women after they've received advocacy support. And it really offers that longer-term support around recovery for somebody who's been through a really traumatic experience. So it can be that longer weekly check-ins, a lot softer, a lot less focused on risk, really supports women to recover after difficult experiences. We also have some MOJ money that helps uplift us with some additional advocates and some support to triage our referrals. I'll show you later the numbers of our referrals, but we do get a high number of referrals, and that is absolutely invaluable to support us to keep on top of them. The next 3 services, the Whole Housing Partnership, Safe Accommodation and Specialist Housing Advocacy, are all services that are funded by the GLA, and they are to support women who are struggling with housing and accommodation. All survivors of domestic abuse, if they're not safe in their own homes, are classed as homeless. There obviously is a huge intersecting need with domestic abuse, so we're really fortunate to be able to offer those services as well. The next two are young people services, so Maya and Lift and the Young Londoners Victim Service, so they are specialist support for young people in LBHF. And finally, we have our Minerva service, which supports women involved in the criminal justice system. At least 70% of the women that we work with in Minerva have experienced domestic abuse. So the intersection there is enormous. So the ability to do both sides of that work for women who've been criminalised, sometimes who've been criminalised actually as a result of being victims of domestic abuse, is really important. Next slide, please. So just a little snapshot of what Angelou looks like in LBHF. So we received 784 referrals for Hammersmith in 2024 to 25. Just over half, so the majority were aged between 25 and 44. That's usually quite typical for domestic abuse services. 63% were from Black or minoritized backgrounds. So that really speaks to the importance of that intersectional approach we offer, and the fact that we're able to have two specialized Black and minoritized organizations supporting our survivors. Over half had children, and 61% self-reported a mental health need. We know actually that most of our survivors are experiencing poor mental health, but this is about self-reporting. So people's experiences of abuse, this is collated across the 3 boroughs. I don't have the data explicitly for LBHF, but 95% of our referrals had experienced domestic abuse. 10% disclosed sexual violence. My guess would be the actual number is far, far, far higher than that, but of course not everyone chooses to disclose sexual violence. And 8% had experienced harmful practices. So alongside, the basic work that we do with all our survivors is risk assessment, safety planning, and support to be safe as they possibly can in the situation they're in. Safety around staying in a relationship if that's what they'd like to do, but also safety to leave if that's what they'd like to do as well. Apart from the risk and safety work we do, the most common presenting support needs that women came to us with were health and well-being, so speaking to their mental health needs, accommodation and housing, going back to the other services we run around housing, children and family support, and support around welfare and benefits. And just to give you a little bit of information about our service outcomes, after support from us, 85% of our survivors reported a reduction in abuse, and 82% reported an improved quality of life. And I think the reduction in abuse stat is particularly significant because, of course, we're only working with survivors. We're not working with perpetrators. So we can't control what he's doing. But even regardless of that, our support and intervention is still helping people be a lot safer. So to move on to some notable trends that we're seeing. So our numbers are going up and they continue to go up. And that happens across all our domestic abuse services. That's not specific to LBHF. So we received 2,362 referrals in the service last year compared to 2021, the year before. So that's a 14% increase. So it just shows that, the scale of the problem is not going away. I think the good thing about that is I see that as more people knowing where to get help. So I actually don't see that necessarily as a negative. Our main referral sources remain MARAC, which is the Multi-Agency Risk Assessment Conference. So it's the process for referral of high-risk cases. All of those cases come through to us, so we can make sure people get Office of Support. And then police are our second most common referring agency. We're also seeing increased complexity of need. So we're seeing increased mental health issues. We're seeing higher instances of suicidal ideation. We're seeing higher instances of multiple intersecting needs. So women who may be experiencing things such as, criminalization, as we've already spoken about, substance use, complex mental health, homelessness. We're seeing that women who come to us are often leading more and more and more complex lives, and that can be very difficult for them. And it does require longer support and more intensive support from us to try and help them get back on track. And we're also seeing, which I think is a positive, a high number of referrals from mental health services. Typically, in services I've worked in before, it's not always that easy to build those links with mental health services, but we're really fortunate that we do receive a really good number of referrals from mental health. We've also seen increased referrals from health in general. So we used to have a health service called an IRIS service in the borough that worked with general practice. Unfortunately, that has closed recently, and we've seen sort of expectedly a lot of referrals from health coming to us since the closure of that service. So there's positives there because we show the service was working, but it's obviously disappointing that it's not there anymore. So just in terms of looking forwards, so as we've already mentioned, Angelou turns 10 this year. We're extremely proud of what we've achieved in the 10 years, and we're going to be having a celebration event. I think it's on the 23rd of June. We'll make sure details get to everyone. Everyone is welcome. We're also hoping to run a webinar series alongside that to really celebrate the importance of the partnership. This is a really unique model and it works really well. So we're really keen to spread the message of how great Angelou is as far as we can. And the event will be called Be a Rainbow in Someone's Cloud, which is a Maya Angelou quote, which is why that quote's on there. In terms of looking forwards, some other things we'd love to do with the support of LBHF is to be able to expand our support even further for survivors. So as mentioned, our referrals are going up and they're going to continue to go up. You know, any additional resource we could have to try and reach more survivors would be brilliant. I think also because we're seeing additional need, there is also a real need for services that can work with people longer term, smaller caseloads with people who really, really need that complex support to meet lots of different needs. We would also love to be able to offer group work. That is something that we do get asked about quite a lot. And again, therapeutic support. There is some therapeutic support available through Women's Trust, who are one of our partners. I'm sure it's no surprise that almost all of our survivors could benefit from some long-term recovery therapeutic support. And of course, that is, you know, therapeutic support is an expensive thing. And of course, that's not something we're currently able to offer. So that's something else we'd love to do. So I think just to end, I just put a few quotes of client feedback because I always think it's useful to hear in the voices of our survivors what the service means to them. I won't read them all out, but the final one I think resonated with me particularly, which was, "She has been my voice, her Ridva, when others would not hear me." So that's everything from me. Thank you very much.
Thank you very much, Amy. We also have Sally Jackson. I don't know if you'd like to introduce yourself from Standing Together Against Domestic Abuse. Just introduce yourself and if obviously anything you want to add to the discussion.
Thank you very much. First of all, apologies for being late. Yeah, the trains weren't playing nice tonight. I thought I'd give myself plenty of time, but no. An hour later, I was still sitting there. Never mind. I'm really pleased to be here. Standing Together has been in Hammersmith for nearly 30 years now. So, you know, we feel a great affinity with Hampshire Council, because the reality is, if it wasn't for Hammersmith Council, we wouldn't have a Standing Together. We, about 30 years ago this year, some council officers and some members of the voluntary sector, the refuge service in Hammersmith, recognised that actually what they were doing, which at that stage 30 years ago was basically the police nicking a few perps when they could and helping women to escape to a refuge if there was a space, and there was never enough spaces. And they recognised that that was never going to deal with domestic abuse. You know, it wasn't enough. And they heard about this work that was happening in America from a woman called Ellen Pence, and invited her to Hammersmith. And what Ellen had done in America, to start with, you may have heard of the Duluth wheel, which is a power and control wheel, and a way that a lot of people first understand about domestic abuse, to understand the concept of everything as well as the physical violence that goes on within a relationship. All the other coercive control, it wasn't named as coercive control 30 years ago, but what Ellen described was coercive control. She also started the first perpetrator programs, so she was an absolute firebrand and leader. And she'd worked locally and kind of recognised the same thing. If she left it to the police and the shelters in America, they were getting nowhere. They were putting sticking plasters on really deep wounds. She needed the whole community to come together. So she devised something called the Coordinated Community Response. And she recognised that if someone has been subjected to domestic abuse, it affects their health, their physical health, their mental health. It affects their housing. If they have children, it affects their health as well. It affects their schooling. There's this whole picture, and all the different agencies that we interact with in society, that have something to offer to support a survivor. So she needed to bring them together. She started to do this over in the States, and as I say, 30 years ago, for the very first time, she came over to Hammersmith and she told us all about it. And it made sense. You know that actually, if you've got a problem, there's more than one aspect to it. And if you only deal with that one part, you're not actually going to deal with the whole problem. So we started to work with a coordinated community response. The council officers and the voluntary sector got together. A couple of years later, you had Standing Together. So I suppose I wanted to say that, we really recognise that Standing Together's home is in Hammersmith. We've gone on and we're really proud of some of the national and international work that we do. But we never forget where we started and where we continue to deliver really important services. And in some ways, I kind of see Hammersmith and Fulham as our kind of shop front, in that, we are privileged to speak nationally and internationally about what works in domestic abuse. And we can do that with integrity because we deliver it. Here in Hammersmith and Fulham, we can say, come and see how our court works, come and see this piece of work that we're doing, come and see how our health work goes, because it's happening. It makes it very well. If I could have the next slide. Thank you. So I think you've already been told a little bit about the coordinated community response, so I won't spend too long on this, but I just wanted to really say it's a lot more than good multi-agency working. It is good multi-agency working, so I wouldn't want you to think it wasn't that, but it is so much more. There's a value base that comes along with the coordinated community response, which is what makes it different. It is a feminist approach, unashamedly. It recognises that the majority of domestic abuse will occur from male perpetrators to female victims and survivors. And there's reasons both that happens, but also that then makes it really difficult for those women to access services and get out to safety. And we need to take all of those into account to be able to give the best service. Doesn't mean that we don't think it doesn't happen to men. We recognise that. And actually, by recognising the differences, we can provide better services. It's not pretending that everyone's the same and needs the same. It's recognising those intersectional differences. We also didn't want the CCR to be that something extra that you put on the top and you have a nice shiny CCR and everything's all right. Actually, it's something that helps every other organisation to do their job better. One of the things that Ellen talked about that I'll always remember is that if there was a death, she would go run into the office, look at her records and see if that was a woman that they'd worked with. And if so, have they done everything right? Just check, was there anything we could have done differently? And if they had done everything right and they had offered all the services, she had a bit of a sigh of relief. It was obviously dreadful and awful that the woman had died, but she kind of knew she'd done her bit. And she thought, but the woman died. So something else is desperately not working in this society. And if I provide a brilliant service, but the service that's referring to me doesn't quite understand that referral pathway, or the service that I refer on to, I don't give them the correct information so that they can make the right assessment, we won't get anywhere. So we need to be able to pull all those things together to create, what they say about the total is more than the sum of its parts. And that's kind of what the coordinated community response does. Thank you. So this is just a quick whip through some of the services that we provide within Hammersmith and Fulham. So the criminal justice work really sort of hankers onto our specialist domestic abuse court. We were really proud to establish specialist domestic abuse courts in the UK. They then flourished and went throughout the UK, and then we had some austerity and we lost lots of courts, and there's not so many of them around. But what's really interesting, in some of the areas where they can no longer have the court, they've kept some of those practices because they've recognised them as good practice and helpful. But we're really fortunate. We're the only one in London, and we have the entire model. We have a service where everyone in that court understands domestic abuse. And I'm going to talk about it in a little bit more detail, as in what happens, what's the impact of having that in just a moment. We also have the Impact Project, and again, that's criminal justice focus, and it certainly started with criminal justice focus. And one of the things that we recognised was if we wanted to improve the criminal justice response. We couldn't just look at, what's the arrest rate? How many convictions do we get? We needed to actually break it down into every single part of that process. So when someone called 999, how long was it before they actually got through to speak to someone that could help them? Once they'd reported it, how long before someone turns up at the door and offers them help? Right the way through to, when it gets to court, is there a successful outcome there? And what does that mean? Is that a criminal justice, a prison sentence? Is it a programme? Is it a fine? What happens? So we literally, with the Impact Project, took that to pieces and looked at everything and seen what we could improve in Hammersmith and Fulham. The Risk and Review Group is one of the operational groups that sits and works with the VORG Strategic Group in Hammersmith and Fulham. And the purpose of this group is, on one level, to be the MARC steering group. So the MARC that we have in Hammersmith and Fulham, the practitioners who sit on there do need to know they have some oversight and some support from senior managers. And so the Risk and Review Group is where those senior managers get together. If there's been any problems, if there's anything that they need to adjust slightly, one particular service isn't filling in the referral forms correctly, it's that level of being able to actually action something that we can do at the Risk and Review Group. It also overviews the whole criminal justice response, so as well as the domestic abuse response, sexual violence, harmful practices, all of those other crimes that come under the Violence Against Women and Girls agenda. We look at those, kind of see if there's anything we could be doing better. And it's also the place that where we have been unfortunate to have a serious case review, a homicide or a suicide around domestic abuse. And we've gone through the process, the review process, to try and learn lessons. That's the place where we'll kind of think, well, how can we, what difference are we going to make because of that? How do we implement those lessons and check and make sure it's made a difference? And if a similar situation was to happen today, it wouldn't end up in that person dying. And the Risk and the Review Group sort of holds the responsibility for that. Within harmful practices, this is an area that we've recognised generally we're not good as mainstream services at understanding and supporting. And who are good is our buy and for services, but they don't have the resources. They're often very much under-resourced, but they have the expertise. So we try and bring them together within that harmful practices group, and also bring them together with other practitioners, so our social care workers, our health workers, so that we can share some of that knowledge, support the buy and fors, but also learn from them so that we get a much better service for us locally. Housing has always been an issue for anyone that's been subjected to domestic abuse. So the housing group kind of looks at that whole, and we have this process now called whole housing. We used to look very much at tenants and what we could do to support tenants, but now we recognise whether you have a mortgage, whether you're homeless, whether you're a tenant, if you're subjected to domestic abuse, you're going to need some additional support. And we put that together again. Hammersmith, we're really pleased, is going through the accreditation process for the Domestic Abuse Housing Alliance, which means once you've successfully done that, which I know you will come sort of autumn time, you know that the processes are of a level that will offer support to anyone that's coming forward. And then we've talked a little, I know Amy's already mentioned the MARC. We coordinate the MARC for Hammersmith and Fulham. So the high-risk cases, putting those through a process where we have all the different agencies trying to think about how can we safety plan to make this person as safe as possible. And then kind of underlying all of that is what we call the Specialist Services Group. And that's a space for any service that's working specifically with violence against women. It may be their full-time job, someone like Advance, but it also may be a drug and alcohol service that has a group around or a specialist around domestic abuse. And we get together once a quarter, talk about what's going on locally, any themes, any trends that we're seeing, any barriers that they're having, and we're able to sort of support them and work together and improve those services and again, learn from each other, which is really important. So I'm just going to quickly now talk in a little bit detail about a couple of those areas, the courts. I won't talk about all the numbers there, because anyone who knows me knows that numbers isn't my forte. But what I wanted to show you is, A, the good news that we're seeing more cases, and they are more successful. So the first measurement is about pre-sentence reports. Why are they important? Well, if we know what's happened before with this case, is this someone that's offended once, or is this someone who's offended multiple times with multiple people? Do we know whether or not within this particular case, there are children, there are extra risk factors, and etc. By gaining all that information prior to the sentencing, then we can be assured that we have a much more a sentence that much better fits that individual. And what we find in our court is that we tend to get a lot more programs to address behaviour and more custody, because we recognise the seriousness. Outside of our court, what you often see, unfortunately, is fines. You can imagine if you're in an abusive relationship and the perpetrator gets fined, who's going to pay? It's not actually a positive outcome. Then conviction rate, obviously, great to see that up at 85%, one of the best in London, and kind of recognising that through the processes that we have, if you come through the specialist domestic abuse court, you have a much better chance of getting justice. We don't do anything that actually gives any preferential treatment to any of our survivors, but what we do is to make sure everything's in place so they get the best option of using the system properly and getting that access to justice. And then just finally, the early guilty pleas. The big advantage of an early guilty pleas, it means the survivor doesn't have to go through that court case. So a lot of stress taken away from the survivor. So good to see it up at that level. But what's also really positive, when you look at all of the guilty pleas, so because of the process, one of the things that our court coordinator will do is to help the police build the file for the case. So she'll notice that maybe the CCTV is missing, or the 999 tape or something. What happens is when defence solicitors see how good the case is, even if it's not an early guilty plea, at a later stage, they suggest to their client it might be a good idea to get a guilty plea, because of course that gets a bit of a reduction in their sentence. So when you look at the total guilty pleas, we're somewhere between 70 and 90% in Hammersmith and Fulham, which again really helps support the survivors. Thank you. And the next one, I just want to talk a little bit about the impact project. And as I say, this started with us really looking sort of quite forensically at what goes on once somebody's rung 999 right through to the court case. And we're really fortunate to work with Advance and have a criminal justice IDVA, so specifically working with those cases that are going through the court. But also from Standing Together's point of view, we have what we call a performance and review coordinator. So she will look at the detail of everything, make sure everything that's possibly could be in place is in place. Look at the trends over time as well, so kind of see if there's an area that we're doing well, and really importantly, an area that we need to improve. So we can feed that back almost in real time. We're not waiting till the end of the year to kind of go, oh, it would have been better if we'd done that. We can really address those things really swiftly. And obviously the main point of that is that enables us to protect the victims. We've got all those things in place. We know what the victim needs. We're in touch with them. We're able to hold that perpetrator to account as well. Thank you. And next slide. Just sort of moving on, because one of the things last year we learned with the Impact Project is actually when we looked at our perpetrators, and I'm sure you won't be surprised to hear this, but there were some that kept coming back. They were serial perpetrators, different women sometimes, or a woman that continually they were abusing. And one of the things that we noticed about those serial perpetrators is often the victims associated with them were some of the most disadvantaged women in the borough. So they had multiple issues that they were dealing with, as well as the domestic abuse that he was subjecting her to. So they may have mental health issues, they may have drug and alcohol issues. And of course, what that tends to mean is that doesn't make them great witnesses. They may be difficult to find. There were all sorts of things that just created extra barriers for them to be able to get to safety. So through looking through those cases, and we identified 31 different cases, we put some professional meetings together. So outside of the Marriott, well, they were already in Marriott, but as you probably know, that's like a one-off meeting. You meet, you try and reduce the risk. It's not case holding, but these professional meetings looked in much more detail, exactly what was going on, what could they do to help her, did we know where he was. Some of the perpetrators we were aware of, we were able to arrest for another offence because we found out where he was. So that got him away and in prison, and she was safe because of it. Brought all of those agencies together, really the CCR in practice, you know, everybody around the table, some of the most vulnerable victims, and creating really positive outcomes. Some of the cases that just weren't able to engage with other services because their lives were a bit too chaotic, but by bringing the services to them, we could help to keep them safe. So it's been really positive to see how that project has evolved to meet the needs of the survivors that it serves. And I think that's about it from me. I'm really happy to take any questions. Thank you.
Thank you very much, Sally, as well. And I think we come back to Katerina.
Hi, good evening. I'm Katerina, and I am the Ending Violence Against Women and Girls Programs and Partnerships Lead at Hammersmith and Fulham Council. So I'm responsible for commissioning a range of ending VOG services locally for victim survivors. But this evening, I'm here specifically to talk to you about our domestic abuse safe accommodation services, so our refuges in Hammersmith and Fulham. And normally, in the spirit of the CCR and partnership working, I'd like to have our commissioned services here to speak to you directly about the work that they do. But due to the confidentiality of our refuge services, I'll be representing them this evening. So at the heart of our approach to supporting victim survivors is the recognition that access to safe, stable, and good quality housing is essential. Sally was just speaking about the need for that. And it's essential for everyone, but it's a foundational necessity for someone who is recovering from the trauma of domestic abuse and trying to move on and rebuild their lives and live a meaningful life that's free from violence. Unfortunately, and this isn't just locally, this is across the nation, domestic abuse is a persistent cause of homelessness. So DA actually accounts for a large proportion of the homelessness approaches that are made to our housing service at Hammersmith and Fulham. And it's also one of the principal reasons for people being placed in temporary accommodation. So it makes up about 15% of temporary accommodation placements currently. So we, as a council, are committed to ensuring that all victim survivors of domestic abuse, including children, are able to access safe accommodation-based services. This commitment is, of course, underpinned by the Domestic Abuse Act and also the Mayor's DASA, so Domestic Abuse Safe Accommodation Strategy, which is refreshed and published again this year in 2025. So safe accommodation and housing in general, it's an absolutely mammoth area, and there are lots of different types of safe accommodation services and models, but as I mentioned, I'm just going to talk to you about our refuge provision this evening. So a refuge, I'm sure you know, is a safe house for people who have had to flee their homes as a result of domestic abuse. So refuges, they're there to support people in crisis situations who have nowhere else to go. Many individuals and the families that come to our refuges, they will literally have left in the moment in an emergency with nothing. They've had to flee with no time to pack, sometimes not even bringing essential items like their passport, ID, or even a phone with them. It may sound dramatic, but it's not really an exaggeration to say that refuges are really life-saving and life-changing services. In addition to providing safe accommodation, a place to live, refuges also provide holistic wraparound support around safety planning, advice on housing options, helping victim survivors to access employment and education opportunities, and also support for the children who live in our refuges and overall well-being and mental health support. So in Hammersmith and Fulham, we have 3 commissioned DA refuge services, each with a slightly different remit. So we have our Women and Children Refuge, which accommodates single women and also women with children, and that has 14 bed spaces for adult women, and then depending on the configuration of the rooms and the families and the ages of the children, we can have about 15 children at a time in the refuge. We also have 2 specialist refuge services, and those are tailored to meet the needs of a particular demographic. Specialist refuge services are able to support people from a particular marginalized background who otherwise may not be able to have their needs met as well in a generic space because of cultural needs, language needs, no recourse to public funds, and things of that nature. And they're especially designed by and for the communities that they serve. So in the Mayor's Domestic Abuse Safe Accommodation Strategy, it's not statutory, but it is best practice to have these specialist safe accommodation provision. And in Hammersmith and Fulham, we are really unique in having 2, and these 2 are the only kind of the only ones of their kind in the entire country, which is why we don't share publicly which 2 they are. But these 2 specialist refuges have 11 and 6 bed spaces, respectively, for single adults. So just to give an overview, in total, the 3 refuge services combined can accommodate at any given time up to 31 adults and 15 children. This is amazing, but as I'm sure you can imagine, the demand for bed spaces in Hammersmith and Fulham and across the nation is much higher than this. So, for example, for one of our refuges, it is really hard to measure demand because they're not advertised unless we have a bed space that is available. But when we do have a bed space available, we receive about 8 applications for every 1 bed space, so 8 referrals. And since refuges are designed to provide crisis emergency intervention, they're not long-term accommodation, and the intended length of stay in our refuges is around 6 to 12 months. Depending on the needs of the individual or family, that can be flexible. Sometimes it can be much shorter or a bit longer. Unfortunately, we do often see people staying for longer periods of time due to difficulties with move on, and that's something that we're working on, and I'll speak to that in a moment. But this past financial year, in 24-25, we supported a total of 41 adults, so new victim survivors who moved into the refuge, and 13 children across all of the 3 refuge services. So I just wanted to take some time now to highlight some of the challenges and achievements which have taken place since we last brought an update on refuges to this committee in 2022. A few years ago, our 2 specialist refuge services in 2023 were actually at risk when the landlord of those buildings decided they were going to sell the properties and dispose of their social housing stock. We were able to come together quite quickly, put together a successful business case for the council to purchase those buildings and ultimately safeguard the services and prevent them from being closed. So Hammersmith and Fulham is now the landlord of these buildings. So that means that we are the landlord for 3 of the 4 buildings from which our refuge services run. And that is best practice in accordance with the Domestic Abuse Housing Alliance accreditation, which we are going for. And this is because it gives us greater control over the quality of the buildings themselves and being able to maintain them and make sure they're in good order. And that brings me to my next point, which is over the last few years, we've really invested a lot of time and some funding into improving the actual conditions of the buildings themselves. As I'm sure you can imagine, some temporary accommodation in some buildings can be quite grim and not the nicest place for people to live. And it can be very off-putting when someone arrives there having left everything with their children. And we got quite a lot of feedback on that and took that into consideration. And in the last few years, we have gotten a range of grant funding, social value investment, and volunteer hours of us painting and redecorating, and we have been able to start refurbishing the buildings and upgrading the buildings. So in this last year, we have redone completely 3 of the kitchens, which are now brand new. We have redone the communal living spaces and living rooms, and we just recently got a grant of £60,000 to replace all of the old broken furniture and get new essential items for the refuges, which is amazing. And we have a provider who's going to give us a discount on top of that. So it's actually going to be £70,000 that we can invest. And one of the things that has also come up quite a lot is access to mental health support and therapy. And as has been mentioned, it is one of the number one things that women and victim survivors tell us that they need. And unfortunately, that not always can be met through the NHS, and it's expensive. There are really long waiting lists. Even with our specialist providers, you can be waiting a year or more before you're able to access therapy. We were able to get some grant funding to offer culturally informed therapy directly to the women living in our refuges. And we don't have a waiting list for that. So if you're in our refuge, you're able to get that. And we have a specialist provider delivering that in about 5 languages, which is, fantastic. Another thing that we've been able to focus on in the last few years is improving move on. So I mentioned that it can take some time. We have the intended length of stay, which is 6 to 12 months. And sometimes we've supported everyone as much as we can. They're ready to move on, but they don't have anywhere to move on to because of the housing crisis that we're facing. And with lots of other difficulties as well. And we have been working really closely with colleagues in our housing department to really improve that process. So we now have introduced monthly move-on meetings for each of the refuges. We have a tracker where we see who's moved in, what date, what is their expected date of departure. And we also take into account what that victim survivor wants. Where do they want to live? Do they want to stay in borough, move out of London? Do they want to be able to have a homelessness application with Hammersmith and Fulham or with another borough, and we'll support them to do that. And having that process embedded with our colleagues and really working in a coordinated community response has made us able to meet our targets this year for Move On in all of our refuges. And the final thing I wanted to mention is our ability to improve our data picture. So because we have a few different services funded through different grants, and we had lots of different monitoring reports, and we didn't have the ability to, across all of the services, capture the same amount of information and be able to really have an understanding of how many people are we seeing, what is the demand for the services, and what is the impact that these services have. So we have improved that. We've got standardized monitoring reports, and we now have a much better understanding of the impact of our refuge provision. But it also told us that there's a lot that we don't know, not just about our refuge provision and the need for refuge provision, but across housing in general. So if you want the next slide, please. We are currently undertaking our own DASA needs assessment. So as I mentioned, there is a DASA strategy published by the Mayor's Office, but we would like to have one local to Hammersmith and Fulham. It's not a statutory requirement, but again, it is best practice for us to have that understanding of what our local residents need and how we can best deliver that. So we will be looking at domestic abuse housing offer as a whole. So looking not just at refuge provision, but all types of housing. So in the private rented sector, looking at temporary accommodation, people who might own their homes or be social housing tenants, and how we best support them. And we are going to ensure that this is a strategy that is co-produced. So we're engaging our partners and stakeholders, but also looking at having consultations and feedback directly from victim survivors and residents. Yeah, that's it for me. Thank you.
Thank you very much, Katerina, and many thanks to everyone, Liz and Amy and Sally, also for coming and for putting together presentations and really for talking to us. The problem I had was that all the questions I had prepared started to get answered as we're going along, which is a different issue. And also many thanks to our officers. Really enjoyed reading the report and how you had the different, the highlights and challenges and so on. It was very readable, and that's very good. And it's very good to see the amazing work that we're doing in the borough and that the organizations are doing, and how this is becoming not just local but regional, national. And I'd be interested to hear what you're doing internationally, Sally, which you mentioned. But I'd like to open the floor to colleagues first with any questions. Who would like? Sally?
Hello, Sally. I don't do numbers either, so it must be the name. You mentioned the 30 years, and I could see how this collaboration and working together is amazing, and I've learned a lot. You briefly touched on the themes and trends. And I just wondered, have they changed significantly over the 30 years? Or are we still seeing the same perpetrator behaviour that we saw 30 years ago?
I think one of the things that's changed is we're much better at recognising it. So I think, you know, we've seen year on year, you know, unfortunately, numbers of reported crimes going up, and that can make you think, oh my goodness, this, you know, this is all getting worse. But actually, I think we used to have, you know, something bad enough for the police to get involved, or bad enough for a woman to have to leave everything and run to often not even a refuge, but a friend's house or something. Whereas now we have midwives asking the question, GPs asking the question, social workers really aware of what the issues are and being much more curious about what's going on at home. So we're definitely much better at understanding generally throughout society that domestic abuse occurs, some of the signs of domestic abuse, and who they can talk to if they're worried about it. And that's one of the reasons why services are so busy, but really positively, that means that women and others are getting the help that they need. I think one of the things we've seen really change is health coming to the table. When I started doing this work, it was nothing to do with health. And you couldn't get them to, you know, to come and talk about it at all. Now they're such active partners, and there's so many interventions going on in primary health, GPs, mental health, the acute trusts, maternity, etc. They really are, you know, they've really recognised that it's part and parcel of the work that they do. So I think the really positive thing is that services have recognised that whether they're delivering housing, health, you know, church or faith-based, you know, if they're working with people, then actually domestic abuse is to do with them, and they're looking after the people that they're working with, so that we get much better opportunity to work with people earlier. So we're actually engaging with people at the beginning of relationships when they've started to notice things like Clare's Law has been really successful, because women are kind of like thinking, oh, something feels off here, I'm not sure, I can go and ask. And years ago, they just, you know, they were being daft, maybe they were being super sensitive, you know, they didn't know. Now we have something that recognises, you know, trust those feelings. We're starting to get the education in schools. I won't mention Andrew Tate because he's taken us back several years. You know, there's some really scary things, you know, that we see around young men's view of masculinity, which I do think needs, you know, we really need to be addressing, and just, you know, recognising what relationships are for. I think one of the things for me that has been a bit of a game changer from a negative point of view is just the accessibility of porn, and what we see as young children, 2 clicks on their mobile phone, accessing what they see as a male and female doing something really horrific and violent, and understanding that as a relationship. And I think some of the saddest conversations I've had is with girls that think that when they're being intimate, it's about what they do for him, nothing to do with their own pleasure at all. They don't even see that as part of it. And boys being really confused because they thought crying meant she liked it, because that's what they've seen in porn. So we're actually educating young people really badly around what a loving relationship is. And I think that's probably something at the moment that for me is really big on the agenda that we need to address, because this is our next generation of relationships. And, you know, I want them to have fun, happy, loving lives, you know, and to feel safe in their relationships, which everybody has a right to do.
And can I just follow up, because everything I've heard is about how people didn't report before, now they report a lot, so that's shifted. So does that mean in the future we're going to see a bigger problem with violence against men? Because I know this is about women.
I don't think so.
Yeah,
she says, where's the wood for me to touch?
Yeah, I just, because you say, I mean, it does happen, but not in the numbers that it happens to women. I just wondered if there's a fear that in the future, as more men feel able to speak about it, we may see a change in pattern?
I think it's always really difficult because for men and women, it's underreported. So it's really hard to say that's definitely the number that's affected. But sadly and tragically, what we do see really clearly is when we look at the murder statistics. And that we see, you know, it's awful, but about 30 men a year will be killed because of domestic abuse. Most of them will be killed by a male perpetrator. So we're talking about family violence, you know, we're talking about sons and fathers, brothers, etc. But when we, you know, well, sadly, we've been saying for far too long, 2-3 women a week, you know, and now even recognising the number of women that can't find a way out and so actually taking their own lives because of domestic abuse. And that number's actually exceeded the number of homicides now. So I think for me, sadly, I feel very confident that this is a gendered issue, that there is around our society, the place that women have in it. Men tend to be more violent. When we look at our prisons, we see the men are in there for violent crimes, the women are in there for shoplifting. So there's something about, you know, what men do and what women do. There's a really good report I'd recommend to you called Who Does What to Whom? And it really breaks down you know, what's going on both within families and within intimate partner relationship. So I think hopefully as we go forward, men will feel more confident to report if they are being subjected to domestic abuse, but I don't think we're going to see like a real rise in that.
Thank you.
Thank you. I just had one question, and we sort of touched on it based on what you were saying, Sally, but obviously the question is open to anyone. How you mentioned about how the things we're doing today, looking back 30 years ago, it's just complete night and day. And I was wondering if you have any thoughts about what might be in 30 years' time that we'll be looking back and thinking, how was this happening? Or, you know, how was that not supported earlier?
I think one thing that's changed a lot since I started in the sector is how we address perpetrators and what we do with perpetrators. So now we have perpetrator programs in the borough, which is brilliant. When I first started in the sector, perpetrator programs were really not spoken about. It was all about how do we get her away? It was all about placing responsibility on her to make herself safe, her to make her children safe. And I have seen a significant shift in now talking about actually, I think it was Respect that did a really good campaign that was like, instead of saying, why doesn't she leave? Ask, why does he do it? Like, shift the narrative. And I think the thing that I would really love to exist in 15 years is at the moment we have systems where most survivors of domestic abuse in their borough, there'll be a locally commissioned service, they can get support, they can get help. Perpetrator services are a real mix. We're very fortunate to have them in Hammersmith. Not everywhere has them, but we still don't have them for every perpetrator because that would be really difficult to do. I suppose what I would love is a system where actually there's an opportunity for any person who is causing harm to get access to behaviour change. Because if we're only supporting survivors, we're only putting plasters on the problem. Because as Sally said, they will, you know, prolifically abusive people will find someone else to abuse. So I think it would be really great to see perpetrator programs becoming more of a kind of expectation and better funded, because there just isn't enough money out there at all for council colleagues or service providers to bid for.
Can I add? Oh, sorry, no, someone else put. I was just, I completely agree with you. And the other thing I hope that we see in the future is much more attention around recovery, both for children and women, because we do tend to do some really great crisis work and get women safe and go through the refuge and get them set up a new house, and then you're supposed to just deal with all those horrific things. You know, we're getting much better at providing trauma-informed services, but they're still quite short-term. And if we recognise the level of trauma that so many women have gone through and what she may need to be able to fully recover, to live her life healthily and, to her full potential, but also really importantly, for those children, you know, when young people are witnessing abuse within their home, they're not sure what safety looks like. They're not sure what a male role model or female role model really looks like. and we get her to a place of safety, but then expect them just to work it out somehow. And I think if we really invested in great therapeutic support for children, in a generation's time, we would see a real difference in the number of women and men, you know, that were either perpetrating or subjected to domestic abuse.
Thank you. Liz?
If that's okay. Yeah, no, I just wanted to echo that point. And I was thinking when you were talking about porn, thinking about the emerging evidence around non-fatal strangulation, its prevalence within pornography, and some amazing research that's been done about the longer term impact on women's cognition as a result of that, and how that might then impact their ability to successfully parent and run their families, and also the kind of prevalence of adverse childhood experiences within the perpetrators of not only domestic violence, but violence in general. So I suppose the conversation, I think we're singing to the converted here, but, you know, the conversation is that kind of, if you were to look back in 30 years time and think, you know, what would we love to have been in place? I think that therapeutic point is so poignant in kind of breaking those intergenerational cycles as well.
Thank you. Annabelle?
Yeah, I just wanted to add one more thing to that. You've pretty much said everything, but I guess it's having those conversations with boys and men as well. I'd like to see in 30 years' time that there's lots of positive role models, there's lots of different versions of masculinity, and that we kind of broken down a lot of the more toxic forms or negative forms of masculinity, which I think will also open up a platform for boys to be able to talk more openly about what's happening for them. So that's, I guess, my final thought really on that.
Thank you. Is this something that the council is doing, Annabelle? Just trying to, you know, bring, as you say, have the conversations, have the male role models.
So one of the positive things is the podcast that we've been doing with the young people who've definitely identified that for them, toxic masculinity is a real issue. They're seeing it in schools, the schools that we talk to as well. They're seeing it. They're seeing that there's a real lack of empathy for girls from boys. So the youth council themselves, which is fantastic because it's come from them, it's for them. They really wanted to kind of send out some clear messaging around, you know, what does a healthy relationship look like? What does positive masculinity look like? So the podcasts were really a great opportunity to do that. It's something that they wanted to do themselves. They've been developed with our service providers. So Advance were involved in that. We also have people from our, you know, health services who were involved in those podcasts and were interviewed. The police came along, our superintendent. We also had somebody from QPR come along who does a lot of work with the young players, talking about positive masculinity. So that's been a really, really positive thing. The next thing that we're doing alongside that is we're developing some like lesson plans, basically, that could be used, 10-minute lesson plans that complement the podcast content that can be used in registration. So really short, sharp kind of ways of just delivering that same message, drip feeding it to young people, bite-sized sessions, not just a couple of sessions now and again when it comes up in the curriculum. But we've also been trialling a very kind of intense whole school approach in some of our schools. The Children's and Family Services got some funding from the VRU to deliver quite a robust programme. So that's been piloted in 10 schools. So from off the back of that, we're going to take some of that learning and see what were the things that really worked well, and how can we kind of further develop that across the whole of our school landscape, if you like. So there's lots of different things happening, but obviously it's a big piece of work, and I'd like to see us doing more in the community. So I think that's kind of where we'd like to focus our energies next and continue to develop those relationships in education.
Thank you. That's very good to hear. Any other questions? Lucy?
Is that working? Yeah. First of all, it's just so heartening to hear such a multidisciplinary and also sort of thorough approach from everyone. So thank you for that. I had a question about mental health services. I was wondering what the liaison's like with our mental health services. We mentioned the children, CAMS and adult services, because you also mentioned buying in support from external providers. So when they leave the refuge, is there a process whereby you can you refer them to the NHS mental health services, and sort of, because it can often be very complicated and quite daunting, the form filling in, and it can also be very it can also be very off-putting going to those places, going to CAMS, especially if there's been a fear of being in that, you know, of the area of bumping into the perpetrator, perhaps. So that's a question. I'm not sure.
What I would say is that our IDVAs are independent domestic violence advocates, will work with people around a whole range of needs. So if they need support around their mental health, then obviously they will offer their own like emotional support to that individual, but also get them to a place where they're ready to engage with mental health services and make those referrals for them. But we do know that there are long waiting lists. And so therefore we're always looking to see how could we improve the offer, how can we make it reduce those waiting times. So that's why we look at alternative providers for that. That's why we've looked at having alternative provision in women's own language. So this last year, we've kind of put some money towards additional counselling through Women's Trust. And we've also looked at additional counselling that is available in different languages and specifically for our refuge, service users in refuge.
Yeah, no, it sounds like you're doing a great job, but I'm just asking about the interaction between the two services. Is that, how does that work really?
Well, I mean, the mental health are definitely one of our main partners, so we work really closely with them. They're members of our Vogue board, so I guess information goes both ways. If our mental health colleagues have concerns, they can pick up the phone and speak to Angelou, and they can get advice around cases. They can also refer cases in. We've seen a real increase in cases being referred to Angelou and to Marat from our mental health colleagues. And training goes both ways as well, so they can access training. So we have quite a robust training offer through in Hammersmith and Fulham that any professionals within the partnership can access. So that means that our mental health colleagues can also access that information. And we work really closely with our mental health colleagues. Does that answer your question?
Yes, it sort of does. I suppose my question is really, how does it work for the children when you want to move them on? Is that process seamless? Is there provision in place for them?
Are you talking explicitly about children who've been in refuge or children who are children of people who've experienced abuse? Because so in Angelou, we would only support people who are what we'd call in the community, so not in refuge. And then the partners that Katerina was speaking about would provide the specialist support for women in refuge. So you may want to answer that point, Katerina.
Yeah, so when we're moving people on, there is a robust plan in place before then. We'll know a few months before that they're ready to move on, and depending on which borough, which area they'll be moving to, we'll make the refuge workers will make those referrals and make those links. So help them get into the new schools that they're going to be settling into, making sure that if there is a need for there to be children's social care involvement, that case is transferred to that local authority if it is a different local authority, and the same with any kind of mental health and access to counselling. It's not always seamless, to answer your question, but there is that support, and we do offer floating support for at least 3 months after someone has moved out of refuge. So it's not just they move out and that's it, the conversation ends. Yeah,
that's what I was thinking of people then moving out and then having to do all that paperwork and all that sort of meeting a new person, having to fight for their...
All of our refuge contracts have resettlement support. So for at least 3 months afterwards, they'll continue to be able to get support from their refuge worker in the community.
Okay, thank you. And I did have one more question. About the court waiting times. You mentioned about the level of convictions, things going up, and early pleas, which is really good. But what happens, we hear about the tremendous court waiting times. What happens to the perpetrator and the victim during that time?
Yeah, it's a huge problem, and sadly one that's too big for us to solve just locally, because obviously, it's affected across the country. The specialist court works within the magistrates court, so that's the lower level offences, and obviously this problem goes through all courts. Interestingly, one of the things that we've seen, particularly since the new legislation about non-fatal strangulation, is a lot more cases that perhaps would have come to the magistrates court are now going to Crown Court because it's recognised how serious it is. There is a huge backlog. We work really hard with our partners to try and mainstream things as much as possible. So I think a few years ago, what we would have seen is a case coming back, not quite ready yet, go away, come back in 6 months. Then we got the evidence and actually that witness isn't ready yet, so come back and go. And we've managed to address lots of those really practical issues within the court, so that there are less times that you would have a hearing to get everything ready for the case, and then the sentencing, rather than additional hearings between that. So we're doing things like that try and make the best use of the system. But the reality is, particularly sort of post-COVID, that really had a huge impact on the backlog and the cases. And, it's not great for domestic abuse, but for rape and sexual violence, the waiting times for trials, I really feel for those women, because how do you move forward and how do you heal when you've got this trial hanging over you, perhaps for 3, 4, even 5 years since the incident occurred?
Just wanted to add, one of the compelling bits of evidence in our joint report, Her Story, Her Justice, is that really the benefit of the impact model and the specialist domestic abuse court is, while we operate within these conditions that are, HM courts kind of in their gift, to a certain extent, the consistent communication and understanding and warmth and empathy has really reduced the prevalence of the victim survivor disengaging from that process due to the length of time. So that just very proactive, this is what I know, this is the update, here's what I've heard. And I've seen in our kind of case files, our victim survivors just kind of updating you on where that's at, and they'll act as the conduit to kind of criminal justice stakeholders as well. So just whilst we can't change the court backlog, that constant source of information helps the victim survivor to feel informed and ready to keep going with that process. So.
Thank you very much. Ahmed, you have a question.
Thank you everyone for your reports and all your work as well. I was just wondering if you could clarify, so the funding that's been secured for women who are in refuges for therapy, the specialist therapy, is that essentially the council pays for them to have therapy sessions with a private therapist, not an NHS therapist?
Yes, that's correct. It's not an NHS, it's an in-house therapist who's been hired by the charity.
Great. And are there any plans, or will there be any funding secured going ahead for, let's say, the council to fund sort of a continuation of that with a private therapist? Because one of the main blocks for access to therapy is obviously the NHS waiting lists are too long, and then for private therapy it's that it's just too expensive. So I wonder if there are any plans to that effect.
So are there plans for us to continue funding this role?
Yeah, or also for, once they leave the refuge, if they need further kind of therapy support. Yeah.
We would love the ability to do that, funding permitting.
Sure. Okay, thank you. Then I wanted to ask really a kind of big question about perpetrators, both current perpetrators and future perpetrators. Boys would be predominantly boys in schools, and just kind of some of the stuff you overhear in the street from teenage boys is just terrifying, and you know where they're getting it from the likes of Andrew Tate. So I guess it's a two-pronged question. One, if you could explain a little bit more about what the perpetrator programs are like, because I think Sally, you touched on it. If there are repeat offenders, and I wonder if someone's a repeat offender and they go to prison, when they come out of prison, they could just offend again with a different person. So it seems to me that a deeper intervention needs to be done, deeper work with that perpetrator. So if you could explain what the perpetrator programs are, and then if you could also explain, coming on from that, some of the programs that are taking place in schools. So if you could just clarify what the whole school program is. So what's being done basically with current perpetrators and future perpetrators, if you could. Thank you.
Well, I think I'll start with young people, because I think that's, prevention is key, isn't it? So obviously we've done a pilot at the moment in Hammersmith and Fulham, and off the back of that, then we would need to look at how we would roll that out across our schools. We'd need to look at funding for that. Just being really honest, we got the funding from the VIU, so at this moment in time, we're kind of reviewing and evaluating that and seeing what else we can do. But we're also trying to be creative by doing our own thing with the youth, Hammersmith, Youth Council. So there's a couple of the things that we're doing there. There are, and there is a program that's funded in our borough called the Bamboo Project. They work with any children affected by domestic abuse, including young people that might be starting to kind of cause harm, exhibiting some harmful behaviours. So they will work with them. And then in terms of the perpetrator programmes that we have in Borough, so we have the culturally informed family approach, which basically has a range of different interventions for different types of perpetrator. So it includes adult children, who are abusing their parents. It includes people in same-sex relationships. It includes, familial abuse, but also intimate partner abuse. They'll work with same-sex relationships. So they'll do a whole range of interventions. They do one-to-one, they do group work. So there's different things depending on what that perpetrator and what the family need. They'll make sure that the victim is obviously safe and supported throughout all of that. And then in terms of the DRIVE programme, which has been rolled out across London, and that's a pan-London, program that basically looks at high harm, and they have different interventions. So they'll directly support that perpetrator, but they may also, where it's not safe to do that, or where the perpetrator is not going to engage, they might look at other ways in which that they can kind of interfere, distract, disrupt that perpetrator. So that might be looking at whether or not they can arrest them for something else, whether they can move them to a different area, look at ways in which that they can kind of intervene, where, and also work with that perpetrator around their needs. So potentially they can engage them because they want housing, they can engage them for whatever reason, and then once they've developed that rapport, they can start doing the actual work. So there's different there's not one size fits all, basically. So we do have different offers where we can kind of intervene and work with those perpetrators. And then obviously one of the options is where they don't want to work with us and they are persistent, then it is about trying to get the best criminal justice outcomes where we can as well. So that's why we have quite a few, obviously, different programs that work specifically around criminal justice to try and hold them to account. But we will always try and work with a behavioural change approach, because if we can change that behaviour, then obviously we can prevent it happening in future. Did you want to add anything?
And obviously you don't have to go into too much detail, but what does that behavioral change program look like? Is it a kind of psychological work, intervention, like therapy work, or?
Sorry, we'll be very polite. Basically, we'll look at the different types of behaviour. So quite often what they'll start off by doing is kind of getting the perpetrators to think about what's going on for them when they're becoming angry or starting to behave abusively, getting them to take a time out. So that's quite a common thing. Obviously working with the partner of that perpetrator as well, and making sure that they're safe. And there has to be that constant checking in with the partner. When they're doing the programs, there will be different stages. So they will look at, initially it's around trying to be safe. How can you kind of what can you do so that this doesn't escalate? Go and take some time out, try and change, and then working more longer term about their behavior and looking at, what are the root causes of that, getting them to take responsibility for the way that they behave, getting them to understand that it's not acceptable that they're behaving the way that they do, getting them to understand that it's abusive. And you'd think that it was kind of obvious, but it isn't always. So it's about unpicking that behavior and getting them to take responsibility for it. And that does take time. You kind of have to chip away at it. So a lot of programs will be easily 6 to 8 weeks. They can be longer than that. They can be 12 weeks, but it will be, like I say, chipping away at that. But eventually what you want them to do is to take responsibility and to behave differently. And that's the overall what you're hoping to achieve. And then the programs that we have will obviously be checking in with the woman throughout, and we will be gaining feedback from them as well as from the abuser about how that's going. Have you seen a change in their behavior? Have you seen a change in their parenting? And then checking in with them after the course is finished as well to say, how are things going now? That might be 3 months down the line. It might be 6 months down the line, because, they could be doing the program and doing really well on it. And then, as soon as the program's over, you don't know if they're going to revert back to their old behavior. But that's kind of how the programs work. Yeah,
that answers the question. Thank you so much. And I wonder, from the feedback that you're getting, are you seeing a positive trend? Is it having the desired effect?
Yeah, it definitely is. And there's the article Mirabelle, isn't there, which is a really good article to look at, which looks at the long-term impact of these perpetrator programs, and looks at a whole range of them and how the long-term impacts are in terms of a reduction in the reduction in the type of abuse, reduction in how often it happens, but also less abusive, so not as damaging, not as violent, so a reduction throughout time. But it also looks at it over a longer period of time as well. So that might that might be worth reading, we can send that on to you.
Yeah, that'd be great. Thank you.
Yeah,
Thank you.
no problem.
And I have one just final question. You mentioned marginalized groups, obviously, and marginalized groups are disproportionately affected. Trans women are a marginalized group, and I think I'm right in saying that among the marginalized groups, they are disproportionately impacted as well, victims of domestic violence and abuse. So can you share, is that showing up in the services that the council provides? Are you seeing that? I appreciate you probably can't share, any kind of data protection aspects to that, but are you seeing that that's coming up, that trans women are disproportionately affected? And then secondly, given the Supreme Court decision, are you concerned that will impact the way the council provides services to trans women? And are there any sort of plans in place for that? Thank you.
Thank you. Yes, that is definitely something that we see, and also something that we hear anecdotally, and it really varies across our services. For instance, we don't see a lot of trans women, or really any trans women, accessing our refuges. And that's not to say that they don't need access to safe accommodation, but there's a number of reasons why they might have barriers, or they might not feel that those spaces are for them. But one of the other areas that I commission is our reduction of harm in the sex industry. And we definitely see a disproportionate amount of trans people and trans women in that sector and in our sex industry coming to our attention. And again, there's a number of reasons for that. The legislation, or the Supreme Court ruling, definitely will have an impact on how services are run. As a local authority, we are absolutely committed to protecting women-only spaces. We're also absolutely committed to protecting the rights and dignity of trans people and ensuring that our services are inclusive. We are in the process of getting legal advice on how that will impact, and we don't yet have any we don't have an outcome yet on that.
I guess I just wanted to add to that, that obviously whatever decisions we make, we will do that with the Vogue sector. So, and I think it's happened so quickly and quite suddenly that everybody's certainly at the moment just in a process of trying to digest that. And as Katerina said, we definitely will take legal advice on that, but right now we don't have a fully formed opinion on what way we should go, but we absolutely want to make sure that whatever we do is inclusive. And one of our partners is Gallup, who will support anybody who identifies as LGBTQI, and that's been part of our partnership for the last 10 years. So I think that kind of just reaffirms that we're definitely committed to making sure that all our residents are supported.
Thank you very much. It's very good to hear this, reaffirming that commitment. We want to have a few minutes left because we need to move on the agenda. But just a final question from me. There is a mention in, I think, item 65, paragraph 65, but I can't remember, which is about how there are new challenges presented by accessing timely information from the Met Police. And I was just wondering if you could explain a bit more about this and what it means, but also more widely, and this is to everyone, about your relationship working with the police, because it's something that surprisingly we haven't really touched on.
Yes, I believe that is in relation to access to the police information sharing system, which is now Connect. And as part of the performance and review coordination contract, which Sally talked about earlier, which is part of our impact project, our criminal justice project attached to the Specialist Domestic Abuse Court, our performance and review coordinator previously had access to the police system before the change to Connect, which allowed them to be able to see cases as soon as they came to the attention of the police from that first call out, and track them all the way through to their conclusion, to understand what the criminal justice outcome was, whether if it was NFA'd, so no further action, and to be able to map and understand trends. It also helped with our referrals to our criminal justice IDVA service, so to the CJ IDVA, who's co-located in the court and the police station, because we know that not always police officers have this on the forefront of their mind, and referrals aren't always being made when they should. So we were able to see where there was a charged DA case that should be with our CJ IDVA. That person could go into the system, find out who the OIC is in that case, and be able to chase them for that referral and work in collaboration with the police on that. The police changed their system to Connect about a year ago now, and made the blanket decision to not allow access to any external providers. So we have fully lost access to that really vital, useful system. The impact that this is having for this particular project is quite devastating, quite limiting in the ability for the performance and review coordinator to be able to do the function of their job. It also means the effectiveness, the efficacy of the SDAC, the Specialist Domestic Abuse Court, is limited, and our SDAC coordinator is having to work with a lot less information. Sally mentioned the pre-sentencing reports and having information about offender history. Without that, the magistrates are not able to be presented with the most accurate information about the risk that that perpetrator poses. And so you only have the information that is there in that moment. And if the police haven't provided that in the report, we don't have access to it live. And that means that sometimes the right criminal justice outcomes aren't, they're not coming to the right conclusions in court. We are doing our best to share information and try and work around that, but that is the limitation that we have at the moment.
Thank you for clarifying. And I know you also said, well, it says in the report that we have been and continue to lobby for this issue to be rectified. Is there any indication that this will be happening? Can we do more lobbying? I mean, it seems to be a big issue. I mean, I don't know if, Neil, you can...
I think our latest gambit was at a meeting at MOPAC. Our court coordinator happened to sit next to the Deputy Commissioner. So we've now got a meeting with the head of IT or whatever, because one of the things that we know is in other forces where they use Connect, there is access. Obviously, go through all sorts of security checks and etc., which is what we did before. But other forces have found a way to enable the voluntary sector to access it for certain purposes. So it feels like there must be an answer if we just kind of look in the right place. So we're waiting now to have this meeting with the IT lead to see if we can persuade them that there's a way to access it, because as Katerina says, it really does impact the effectiveness. And thankfully, our court coordinator has years of experience, but she is finding now she's having to think on her feet in the court, because that information comes up then and there in court, whereas previously with Connect, she would have been prepared because she would have had access to that and she would have been ready for it.
I think it really sounds like it has quite an impact and, quite a debilitating impact. It would be good when we have the police next on this committee. We usually in November to talk about this with whoever comes, whether it's Craig Knight or the chief superintendent. But I don't know if in the meantime we can continue to lobby, and I'm sure if we have any clout as a committee, if you can say that, of course, we also back any calls for this to be improved. I think we'll have to stop here. But Councillor Harvey, do you have anything to add to everything we've heard?
There's just so much amazing, great work going on. I feel proud to be holding this role and hearing about the amazing work that's happening and the impact that it has on our residents. I know because of my other hats with community safety and the strategic assessment that we know, for example, there's a higher proportion of women that are now coming forward to report rape in the borough within 14 days compared to anywhere else. And that's been a significant change compared to previous years. And when I was hearing that, I just thought about all the amazing work we're doing, the high profile of the work we're doing in the borough, the No More Sexual Harassment campaign, the fact that women in our borough can be really confident that we've got great services delivering and dedication from organisations like yourself, from our amazing colleagues over there in the teams. And yeah, it's just really fantastic. And I think sort of thinking about some of the things you said, especially Sally, around young children and needing therapeutic treatment. We know also that when people are going through violence and fear, it takes a long time for them to be able to feel safe. And it's often when you become safe or you start to feel a little bit safe, the real impact of that trauma then impacts on you and starts to show itself. And we know a huge volume of women will have post-traumatic stress disorder. The children that have seen it, witnessed it, experienced it, that violence, the small things like gaslighting in the scheme of the big picture, like those things that really have a huge impact. And you know, when you experience it as an adult, people doing it can bring you back to the experiences of a child and those impacts. So kind of having that really important therapeutic support, specialist support, ongoing throughout people's lives sometimes actually is so, so important. And the funding, I am pleased to say this funding that we got in the budget is in the budget now. It's not going to go away next year, it's there. And we will continue to look to see how else we can increase it and what more we can do. But that's there now. So I just wanted to reassure everyone, as far as I'm aware, it's not going anywhere. It's really important because what we're doing is making a huge difference to people's lives. So thank you so much. Yep.
Thank you very much. And on that note, I think we'll, well, I need to ask the members, do the members agree to note the report? Thank you very much. And again, thank you all for coming from all the different partner charities, from our officers. It's been a pleasure having you, and look forward to having you again in the future. Thank you so much. We'll take a 2-minute break just to change between the different attendees, and we'll be back in a couple of minutes. Thank you. Right. Thank you very much, and apologies for having to wait, but I'm sure we'll now have a second very interesting conversation. We will now be talking about the Gangs, Violence and Exploitation Unit, another service the council we're very proud of and has done really great work over the last few years. And I would like to invite Gemma to start the conversation.
Thank you, Councillor Souslis. So, yes, as the paper describes, following the inception of the Gangs Unit in 2020, the team has continued to expand to meet the needs of young people and their families in the borough. We have a team consisting of various staff, outreach workers, an enforcement officer, 4 police officers, a therapeutic intervention advisor. And as of March this year, we've supported 155 young people through the work of the outreach workers who provide each young person with support and assistance in engaging in a variety of important interventions, focus being on early intervention and preventative measures in relation to gangs, violence and exploitation. On average, our outreach workers have about 10 to 12 young people on their caseload at one time. And it's a huge amount of work that they're having to do, accompanying them to court, helping them with parents and carers, filling in forms, you name it, we do it. And due to the nature of our cohort, we provide high-level systemic and trauma-informed practice to meet the complex needs of our young people. And we have long-term relationships. We are fully aware and looking at best practice. We don't just do a 12-week intervention. We work sometimes with people for 3 or 4 years to try and assist them. Since the inception of the unit, our work and reputation has grown significantly within the borough, across the BCU and regionally. Our work is now significantly recognised by London's Violence Reduction Unit, which is part of PAC, and has been one of the best practice units with unique projects that recognise the needs and aspirations of our communities. And as a result of this, we were asked by the VRU to speak at their London-wide conference about our achievements. The VRU has and continues to provide additional funding to the GVU, which allows us to commission further bespoke services for our young people. And this paper specifically focuses on the project and early intervention work of the unit. In line with our commitment to centering the voices of young people in our community, we've invited Saeed Mohammed, Chief Executive Officer of Minaret Community Centre, and Dominique Alexander, Ambassador of our YPAG, our Young Persons Action Group, to this meeting, and you'll be hearing from them shortly. The Violence Reduction Unit offered the opportunity to the London boroughs to apply for funding, and I'm really pleased to let you know that we secured £280,000 worth of funding to deliver their My Ends programme through community-led initiatives in hyperlocal areas to tackle violence, including diversionary projects for young people and their families. This includes support networks for parents and carers, as well as sport, music, arts and drama activities for young people. We recognise, and across the country it's recognised, that early intervention is the key to tackling gangs, violence and exploitation, hence the need for projects. Funding from the VRU is allocated to intervention work in specific areas of the borough based on identified needs. And so we collaborated with the police, external partners, and residents to understand and map issues related to gang activity, violence and exploitation, which informs the strategic placement of the projects. Alongside listening to our statutory and community partners, we carried out detailed analysis of crime and deprivation data to inform our decisions. So during 24-25, with the My Ends funding, we allocated to communities in the wider West Kensington area, including Burne-Jones House, Samuel Richardson House, Southern Housing Estate, West Kensington Estate, and the Lily Road Peabody Estate. And alongside partners, we decided to focus on this area due to it being disproportionately affected by youth violence over a number of years. And we also noted that the levels of deprivation across the above areas fell into the 2nd and 4th lowest deciles in borough in terms of deprivation. The funding has delivered the following projects, which were decided through our regular Mayans partnership meetings, and that includes residents' voices and our statutory and non-statutory community partners. So one of the projects is the Minaret Parent and Carer Project and the Youth Project. We have established a strong relationship with the Minaret Community Centre who deliver these projects, and it's a culturally focused hub in Fulham that serves the Somalian and broader East North African communities in the borough. This is in recognition that within the West Kensington area, the Somalian community has been disproportionately affected by youth violence. Through this collaboration, we've funded a year's worth of weekly parent and carer sessions to be delivered by Minaret to address the increasing stress and challenges faced by parents in and around the West Kensington area. These sessions raise awareness about identifying signs of gangs involvement, violence and exploitation. And then we've also funded Minaret to deliver the 12 months of weekly sessions to young people, equipping them with knowledge to recognise and avoid gang involvement, violence and exploitation. And the positive impact of this partnership has been acknowledged by the local online press as outlined in the paper. So we do have Saeed here, who I'd kindly like to offer the floor to explain how the project has worked in practice and the rewards you've seen from it and how it's helped your community.
Okay, thank you, Gemma. Thank you, everybody. My name is Saeed. I am the CEO of the Minaret Community Centre. Minaret Community Centre is a frontline charity established in 2009, and we manage one of the few, how you say, culturally specific buildings, really, in the borough. I mean, where we basically have a specific interest into the Black and minoritized communities and refugees and asylum seekers. Those are our area that we cover. We, as an organization, our main real objective is to bridge the gap between our community and to the service that without us, it will be very difficult. So this kind of partnership with the statutory and non-statutory organizations give us this leverage that we can serve better our community. And from that perspective, we were lucky to have a connection with the unit about the gang violence. As you all know, the gang violence in our community is the elephant in the room. Everybody's suffering about it, everybody talk about it, and nobody has the answers. So sometimes the people go to the extremes to take these children out of the country for safety. Some of them, I remember, not this, but before, we have had many workshops and where we invite the statutory bodies like police and the counselors as well. And one of the ladies, I remember, she was asking to the police, can you arrest my child without committing any offense? Because that's how she saw the safety, because he was in danger. She knew about it. She didn't know what to do about it. She could not, nobody could help her. And then the police said, without a crime, we cannot arrest anybody. Just to give you an idea how the situation was good. Going back to the project that we are doing with the unit. As I said before, we have had many projects before, but I must be honest, this is quite different because for two reasons. Reason number one, the unit, not because they are here, because that's what the people tells me, the feedback that we are getting from the workshops and the community events that we have been doing with them, is because it's very specific. For example, this My Ends program now is in our area, basically in where we are based in Fulham, especially in my surroundings. So we could target better people, few people who knows each other, neighbors, and then they were communicating between them. So the program, as Gemma mentioned, is two parts. One is the parents and carers, and the other one is for the youth. Both of them, we have got workshops, small workshops every week, and we have got community events every month at the end of each month. During that events, we have the unit provided really the speakers to the community, which we choose with the community, specifically the areas that they need. Every session we discuss at the end of it, and then we ask the ladies and gentlemen what they would like to see next meeting. It's not something written, it comes from the conversation. And I speak to the unit and said, can you guys provide somebody from the police? And they said, oh, we have our own police. They came to the community, they speak with the community. For the first time, I must say, the conversation between the police from the unit, Laura and Mo, the names, they were really connected with the community. They were speaking to the level that the people could speak up from their problems. The most difficult in my community is to know who is happening what. Because everybody, every family, when they have a problem, for example, if their child get arrested or get involved into the crime, they don't share with other people because of this stigma. Because, I mean, the community blames the family for the child. Oh, she didn't look after her child properly. She didn't do this because of that, which is not true. We know that. We know this because we have got a supplementary school in our center where the children from year 1 until year 6, they are the best child of the world. When they move to the secondary school, something happened somewhere, and then some of them goes to the wrong direction. And then you ask yourself, why is that? I don't have the answer to that, but I know that there is this something triggers from the primary to the secondary school. And coming back to the project, I mean, all these sessions that has been happening, each session was targeted specific. For example, I can mention another session was about the school, because the other day we were discussing about, and they were complaining, everybody was complaining about the school, and they're saying, oh, they kick us, our children easily, they send us to the street, and they don't care about the outcome. And then we said, let's invite somebody from the council who knows about this, who can answer this question. So next session will be about that. So that's how we have been doing it. This is third quarter now, we are doing it. We have got one quarter to go, and then the program will end after one quarter. The outcome of this program, we have seen already effectively the results. How? Because when the people come back into the workshops, which is smaller than the event, we discuss about what happened into the events, and we go into the deep, and the ladies especially talk to each other. We have this coffee mornings where we share the issues. So I can mention, for example, one of the ladies came back to us into the workshop. They don't normally talk about their business, but since we have started this program, we created the environment, the secure environment where the people can break down into the tears, basically talking about their experiences, and they share each other without any stigma. Because when we started, we said everything that we say here stays here, and that has been happening really since we started. So to conclude the whole conversation about this project, it's different and it's really working for us in this specific setting that we have been doing it, and I hope that this kind of activities continues. Another example that I can mention was the other young man who his siblings were involved into the crime, and his mother, she was worried about it, and she shared with us about. We said other two, they are already gone, she said, and this one is a good one, but I'm afraid for his future. And I shared that information with the unit, and the unit started to talk with the child, and we tried to listen exactly what he would like to have, and then we support him to create. He said, I want to do my own business. I said, we cannot do our own business now, but we can get you the job. He has got a part-time job, and now the mother said she's very happy. First time that somebody is really doing about something about it. So my conclusion will be, if everybody does their own job, the children won't be safe. So I think my message will be everyone involved, whether it's statutory or not statutory, to go to the extra mile just to save the children's life, because it's really as simple as that, saving the lives of the children. And I finish here. Thank you.
Apologies. Thank you, Saeed. Going back to the paper, another partnership that we've developed is with Rebel Records, an independent recording studio and label based in Fulham. This project, Rebel Records project, was initiated based on feedback from parents and carers of young people in the borough who highlighted their young people's interest in drill music production. Rather than dismissing this, as I think a lot of other agencies would, seeing drill as a negative impact, we have recognised its potential and harnessed it to achieve positive outcomes. The project highlights the importance of dedication, focus, and avoiding negative influences through music creation, giving young people access to the Rebel Records studio, and this is for a whole day at a time, so they're safe and off the streets on a Saturday or a Sunday, which is a huge amount of time to be safe in our borough. They learn music production, writing skills, and the basics of the music industry. We're also delivering a motor vehicle training programme with the Harrow Club, who's well established in the community. This is delivered the motor vehicle training programme designed to track young people who have engaged in or at risk of engaging in the theft of bikes and other vehicles, which are often seen as linked to the entrance into gangs, violence and exploitation. We also delivered just recently, in the recent half term, the residential with the Harrow Club. We've collaborated with them to provide an opportunity for young people to leave London, spend a week in a rural location and engage in something thoroughly unique called debate boxing. It encouraged young people to express themselves through reasoned debate rather than arguing, and regulated boxing rather than fighting. I'm pleased to say this is attended by some of our most at-risk young people, we would say, in our borough, and feedback so far has been hugely impactful. It's life-changing, the fact that they've been able to get away from really hard times within their families and engage in something positive. So the upcoming work for 25-26 with the Mayans funding is we are going to focus on the Clematley estate area. Again, listening to the community and what they require. We recognise the importance of physical activity for young people, and we will be delivering street dance and boxing sessions to young people in the Clematley Community Hall, which is really important. It's at the centre of the estate, as probably all of you know, and a very underutilised resource according to the community. So it's really important that we bring the resources to the young people and their parents and carers. During these sessions as well, along with all of our other projects, the GVU community development outreach worker, like Ketchy over here, will deliver sessions for participants raising awareness of gang activity, violence and exploitation, and how to access support if you're being drawn into that type of world. We've also funded street dance classes at the Queen Caroline Estate Community Centre, which have received high engagement and positive feedback from residents, with a parent of the street dance class saying, "Thank you so much. It's great for local children to have somewhere to go and can see their confidence and community spirit grow." We're offering unique courses as well. We're offering a grills course, and this is following an innovative idea made by a young person who we listened to. So it's dental jewellery production courses for young people aged 16 to 21. It's a 2-day weekend course, and participants will be taught how to make their own custom grill by a fully qualified dental technician. Alongside providing participants with technical skills, the project will highlight the importance of focus, concentration and dedication, with their custom grill to take home, symbolising the result of harnessing the above skills. And already through Ketch's dedication, we are seeing significant interest from young people who ordinarily they like to work with an outreach worker, but when you're saying get involved in X, Y, Z, no, but through something that is really gripping to them, they are signing up to this, which again is really positive, keeping them safe off the streets and developing their talents. We're doing a DJing course with Rebel Records. We fully recognise young people's interest in music production. As I've said, Rebel Records continues to thrive. So this is adding a unique addition to this. Again, that's going to run from the Clematley estate. And as one of the closest youth clubs to the estate, we are working with the Brunswick Club to get those young people to come across the street into the community centre. There'll be a mobile DJ set up, which will attend the youth clubs and also the Clematley Community Centre. The course will be able to work with individuals on a one-to-one basis or groups of up to 6. And again, you're being taught the full spectrum of how this works, how the equipment works, and it'll be a creative outlet for young people. We want to create spaces for young people at risk of gang involvement, violence or exploitation to express themselves with creative outlets, and therefore we're collaborating with Intermission Youth, a charity who use Shakespeare to reflect young people's lives to deliver a theatre programme, again out of the Clematley Hall. The project will foster self-expression, teamwork, confidence, motivation, self-esteem, creativity and literacy in participants. And it's been really fascinating listening to Ketchy after attending their sessions and learning what they do. And fascinatingly, one of our outreach workers completed the course with Intermission Youth herself as a young person. Monologues from the Manor. This will be a programme to be delivered to young people during the summer holidays, again, keeping young people safe throughout the holidays. They will learn how to produce a range of monologues to be performed and recorded for film and or theatre intended for showcase. It will be an outlet to express their collective feelings and attitudes. I cannot speak highly enough of Ketchy and Corinne at the end of the table, who have been provided amazing innovation with Glow and Grow beauty course. We are committed to providing safe spaces for young women and girls at risk of violence and exploitation, which is in line with the council's commitment to tackling violence against women and girls. And we listened to young women and girls. You know, interestingly, not a lot of them were interested in our Rebel Records project. So what would you like to do? What is going to gain your interest? And as can be seen through social media, TikTok, they're interested as young women in beauty, makeup, and generally the industry. So Ketchy innovated the Glow and Grow project in collaboration with the local youth organisations, West Youth Zone and the Harrow Club. And this is a 5-week makeup course, which was delivered already in West Youth Zone. It's now being delivered in Clematley Estate to a cohort of 10 girls at a time, followed by an accredited individual lash extension course. And I don't think we can underestimate how this is transforming young girls' lives to have confidence and passion. One participant shared, I will use these skills for the rest of my life. I could turn this into a career. Whereas at the beginning of the course, for a shy and reticent young girl, not knowing what she was going to do, that's a huge transformation. We're going to have a mentoring program for young women and girls with Kairos Girls. This will be a mentoring service and safe space for vulnerable girls who are at risk due to their age, gender and socio-economic disadvantage. Again, listening to our young people, a barbering course, making sure that young people have something to aspire to. It's a really important point that Ketchy, Luke and Corinne from my team have picked up on. A lot of young people, yes, they may want to go into work, but a lot of young people looking at social media, they want to work for themselves. So let's give them the skills to do that. So we are delivering a barbering course to equip the young people with the skills needed. They were taught about building a career in barbering, basic haircuts, skin fades, and various styles to expand their portfolio. And I think really interestingly, this has led to the team thinking about an ebook. So what we're going to do is, because we've got all of these projects that are pushing young people forward into careers, we want to ensure that they have long-term access to resources, ensuring the outputs of projects are sustainable. So designing a digital ebook on building and marketing a personal brand to be of access for all young people on GVU projects is what we're going to do. It'll be a resource open to every young person and will be able to be downloaded through a QR code. And on Clemathley Estate as well, our parent carer sessions are going to be continued with FunPact, who we've worked before on White City Estate, which is a local charity. Again, they'll be working with parents and carers to raise that awareness of gang activity, violence and exploitation, and how to tackle that, and really educating parents. And it was amazing to see about the innovative way that they teach parents and carers to communicate with their young people. Our ongoing work is still happening in schools. Our outreach workers have led on a continued workshop in schools, but also broadening that out to special educational needs schools. So our gangs, violence and exploitation awareness sessions have been developed. So we have worked with the schools to adapt those presentations for special educational needs schools. We are fully aware that pupils of those schools are more likely to be a target for gangs, violence and exploitation, hence why we responded to that need. Again, we've had brilliant feedback from Breckenbury Primary School and Pareja Special Educational Needs School, as you'll see in the paper, have also provided us with some amazing feedback around the sessions which our team have delivered. We've got a really exciting project with the Lyric Theatre. They are due in June to deliver a touring project, raising awareness of county lines exploitation to year 6 and year 7 pupils across schools, youth clubs and pupil referral units in the borough. So this is a play that has been developed that we hope that by children watching it, they will understand how easy it is to be exploited into gangs, violence and exploitation, but most importantly, where to seek help. Our work continues with preparing for Notting Hill Carnival. So since the inception of the GVU, we've continued to deliver interventions for young people during Notting Hill Carnival weekend. We work closely to prepare for that with Children's Services, the Voluntary and Community Centre, RBKC and Westminster City Council. We ensure that young people are provided with safety planning guidance. Additional youth club sessions are put in place across that weekend, and we facilitate conversation with young people about not only if they are under certain orders and CBOs, which enforcement conditions they must follow, but also providing them with support and guidance and safe spaces to attend. Really excitingly, we've developed a young person's action group, the YPAG, and as evidenced earlier in the paper, that's where the idea for the Grills project came, and so we responded to that request. The reason that we've drawn together a YPAG is listening to the success of the Violence Reduction Unit's YPAG. It's really inspirational to see how those young people have developed. So we now facilitate YPAG session with young people who are either open to us or have been open to us in the past or have taken part in our projects. And this has enabled us to gain a fruitful understanding of the needs and interests of young people to inform our service delivery and co-production. And I'm really, really proud to have Dominique by my side, a member of our YPAG, who was previously supported by one of our outreach workers. And I thought it would be really helpful. And Dominique has always said she wanted to give back. So if Dominique, you could explain the benefits of the long-term support from an outreach worker, your experience of attending the Rural Records project and how that assisted you, and what's your experience been of an ambassador of the newly formed YPAC?
Hello everyone, my name is Dominique Alexander. Like Gemma said, I was a young person that was involved in the Gangs, Violence and Exploitation Unit initially. I wasn't very forthcoming to start with due to my previous experiences with engaging with services weren't always the best. I never really got a good outcome from it, and I didn't think that it was really worth it. But luckily for me, engaging with them, it turned my whole perspective around straight away. My outlook worker, Shirley, and she was an absolute blessing. As soon as I met her, it was just instant connection, instant comfortability, which I never expected, like I said, because I've never experienced that before. And I feel like to be able to help somebody, you need to have trust. You need to be able to build a relationship. And like I said, it was instantaneous. So there was no issues there, which I've never experienced before. So it was really a good experience for me, just before we even got down to anything, just building that relationship. It was like having a best friend. She's more or less my fairy godmother, because she just did everything straight away. There was no issues, comfortability, 10 out of 10. There's not a bad word that I could say about my involvement in it initially. Coming from where I was coming from at the time, I was really struggling mentally, emotionally. There was a lot of things that I needed support with that I didn't expect to be able to get, especially not from this unit. So when I did, it was quite an overwhelming experience, because not only did I not expect it, but it was so easy for the support to be provided, and it was happily done. Like, they genuinely wanted to do it. Which is another thing that I've never experienced before. I feel like the personalities of the people on the unit really contribute to how successful they are, and I have to commend it, because that was one of the main things for me, that the people that were there to provide the support, they really wanted to do it, and you can tell. And that's really important, because seeking assistance and support is really not easy, especially when you're coming from a dark place, should I say, and there's a lot of young people that struggle to ask for help. I was one of them. So for me to be able to get somebody like Shirley and to come in and just give me my glass slipper so I could go to the ball, it was just a really overwhelming experience. There was never a time where I left her and I wasn't in high spirits. Just a conversation over the phone or in person, I was skipping all the way home every time. It was so nice. And that continued with all the other staff members that I'd met, like the ladies on the panel. It never changed. And I was so happy about that, because I was thinking, oh my God, they've only got one person that's really, like somebody nice. So when I met everybody else and it just continued, I was like, no, you guys are doing really well. Like, this is 10 out of 10, 5 stars, guys. Like, I'm proud of my borough for this one. So yeah, and following with that, Shirley, and she put me onto the program with Rebel, and it was probably the best thing I've ever done in my life. It really encouraged me to think positively about myself. At the time, like I said, I was really struggling mentally and emotionally, and I was kind of at the bottom. So I needed something to kind of give me that little push. When you first start riding your bike and you need someone to hold the back, and then they let go and you just keep going. That's what it was for me. As soon as I got in there, everyone could see that I was really nervous, and I was like a little bit withdrawn to engage. And everybody just kept it, 100. Everybody was themselves, and it was a very comfortable environment, very like just comfortable. Really, I wasn't worried about anything. My nervousness soon disappeared. The guys were like, listen, you've got this. Like, there's nothing that you need to worry about. So it kind of disappeared. And then we got to business, and it was like, yeah, I can do this. I'm the man. Throw me in the studio. Let's get busy. And we had a performance at the end, which Gemma was at, Neil was at, Kesh, you was there, right? No, he wasn't there. Okay, Corin was there. And the guys came along and kind of saw what we had been doing during that time, which was really nice for me. And a lot of the other people that was alongside me as well. It was just really nice to have everybody there and just to witness the progress that we had made within the program. And it was nice for me also to see the effects of it for everybody. Like as a young person, it's very difficult to comfortably be yourself and say things that you want to say and behave how you would normally behave. So being in that environment where it was just natural for everybody to just be themselves, it was amazing. Like there was nothing that was holding anybody back. So I would definitely, and since I did the program, I've been encouraging and enthusiastic of everybody to jump on it, because it was just the one. It was the one. If you're a person that struggles with confidence and kind of being yourself, that is definitely the program for you. And I feel like a lot of young people do. I know a lot of young people myself that struggle with a lot of these things. And that program is definitely something that I would recommend. I have to big everybody up for even finding that program, because it does wonders, and it just is so much fun to do at the same time. So I feel like whoever came up with it, who was it that came up with it? Kieran. Shout out Kieran. Kieran and Ryan and Jem. Their stars, all of them. My ending with my outreach worker, it was really sad because she did so much for me. Like I said, I wasn't expecting it. I wasn't expecting to enjoy it. I wasn't expecting it to be as fruitful as it was, because everything that was promised came to light. And that was so important for me, because she had literally broken down all my barriers. Like I came in with big boots, a big chest of armor, and when I left, it was gone. I put all my faith in her, and she delivered. The unit as a whole, they deliver. That is one thing that I will say, and I will scream it till the cows come home. Everywhere I go, I say the same thing. It's something that I'll never forget, and I'm so grateful to be able to say that I took part, because it's one of the only things that I've been able to engage in that's actually done anything for my life and encouraged me to maintain that way of life and way of thinking. So yeah, my completion with my worker ended me up being an ambassador. You know, I've got the little title, which I'm really happy about and I'm really proud of, because I'm really passionate about the group. I mean, the ladies, they really kill themselves to make things happen. Like I said, they deliver. They really go all the way, and they listen, which is really important, because it's what gets them to where they need to be by listening. They listen to the young people. They want to know how the young people are and genuinely have an interest for them, which is, you can see straight away. Like there's a lot of people that do similar jobs, and like you can tell that they're just doing their job. They're not really, their heart's not really in it. But with the ladies, it's a completely different thing. It's just, I'm just so glad to be here just for that reason. I love it. It's a beautiful vibe and it's genuine. So I feel like it's one of the very few organizations that are doing good. And like I said, I'm really proud of it, because I've lived in the borough since I was a kid and I've never experienced anything like this. And yeah, being part of the group now as an ambassador is amazing. I'm grateful that, like Gemma said, I can give back. I can share my story, which I feel like is really important for people that are quite hesitant to get involved, like I was initially. And I think that if I had somebody that would tell a story like mine when I first got involved, I wouldn't be hesitant at all. I'd be like, right, get me in there, get me on whatever program, let me get a worker. I want to be involved. Like, let's do it. So it's been an amazing journey from beginning till now, and I'm nothing but grateful for it. And I have to commend the ladies, because like I said, they do a lot and they deliver. So yeah, I just want to say thank you for allowing me to be here. I really appreciate it. Yeah, that's it.
Thank you, Dominique. And we are, you know how we've said it so many times, all of us are incredibly proud of you. And just to add, when we met Dominique, there was a lot going on in Dominique's life, which we won't go into. It was a really, really tough life for you, and you were in temporary accommodation in the borough. And I'm so proud that you have your own tenancy, you've had it for a good couple of years, it's successful, there's no issues, you've become good friends with your elderly neighbour who gives you a hard time that's just you now have the confidence to develop relationships, and through Shirley and outreach worker sorting out lots of things with you, paperwork, you did it together, you've now got a job, you're really loving your job, you're really good at your job, and you've been doing that for a long time. So when you look at the journey, and it isn't this 12-week program, it's not overnight success. There are years worth of trauma that we have to unpick, but we do get there. And then for someone to be living this amazing, fulfilling life, we are so incredibly grateful that you came into our world as well.
Oh. Thank you very much. And everything Gemma said, thank you, Dominique, for coming. Thank you for your incredible work. And thank you, Said, as well, for coming and for speaking to us. It's really great. I mean, we've said it before, we've said in your presence, we've said it behind your back, but it really is great, the work you're doing with the unit and with everyone. And for my part, it really is amazing to hear all the great outreach work you're doing and how you work with so many different charities and doing so many innovative things. And I think it really brings together Councillor Harvey's sort of portfolio and, the name of this committee, which is social inclusion and community safety, bringing everyone together and bringing the community into, it takes a village, and that really shows it. I'll open the floor to questions from colleagues to begin with.
Well, not a question.
Comment.
Brilliant.
Thank you, very well done. Do we have questions? I just have a couple, if I may. Well, if you could tell us a bit, Gemma, on future plans for the unit to expand, or what you would like to see. There's more partnerships or different projects. Yeah, if you could tell us.
I think it's to continue with our innovation. I think we've grown from, you saw us at the beginning, very humble beginnings, where are you going to go from here? To be one of the best in London, to have that recognition from the Violence Reduction Unit says it all. And I think we've just got to continue to grow. I think, as I said, this paper focused on the early intervention and the projects, but I think, at some other point we can come back and talk to you about the enforcement. We fully said at the beginning, you can't tackle gangs, violence and exploitation without having all the strands, we believe. So all of this amazing early intervention work, but enforcement where it's needed, working with the police on the intelligence picture, working with our probation services. So I think it's just that continuation to be the best. We have developed, we've now got 2 community development outreach workers. We have Corinne at the end of the table, our graduate, who's been with us for just over 6 months now. We've got that therapeutic intervention work now, which I think, looking back, if that therapeutic worker had been there at the time, for example, when we had Dominique, we would have said, like when we was talking in the earlier paper, don't go on a waiting list. Our young people that we work with are not going to go into CAMS. They're not going to wait for the appointment. But what has worked really well is our outreach workers selling therapeutic intervention and saying, it's here now. Why don't, when we meet in the coffee shop or Nando's next week, why don't I bring Abiola, have a quick chat with her, I trust her, you'll trust her, and from that has developed some really useful therapeutic work, which definitely goes a long way with our young people. I think it's been really interesting that we've increased our hours. This is through funding from Public Health, who fully recognise the work that we're doing. So I think it's just looking out for those niche pieces of work, looking into other avenues of getting the funding and bringing that into our team. So it's listening to everyone in the team that we do, but our young people and the community.
Thank you very much. That's very good to hear. I guess another question I had is also, we've seen how obviously, violence doesn't stop at the borders of this borough. And I think there have been recent incidents where residents of Hammersmith and Fulham have been involved in violence in other boroughs or vice versa. How are you working exactly with other boroughs for example, obviously our neighboring ones to begin with?
So we're really fortunate to have amazing relationships because we are one BCU and we have gangs police across the BCU. But we also have those excellent working relationships with Kensington and Chelsea, not just at the we have it at manager level, we have it at that outreach worker level. So they're talking to each other, we're sharing information. Outreach workers talk to each other as well. So it's sharing those community contacts. For example, when K&C host events, they welcome us to show that joined up collaborative work into the community. The same goes for Westminster. It's continuing that talk, and we have regular information sharing, cross-borough intelligence meetings, not only with those boroughs that I mentioned, but with Ealing and Brent. I have to genuinely say there's a lot more tensions between other boroughs and other boroughs rather than our boroughs and their boroughs. So we're quite fortunate. But when there have been issues, saying go back a couple of years in South Fulham, between our young people in South Fulham and that crossover into World's End Estate in K&C, we're able to rapidly respond. For example, even including our voluntary and community sector partners, because for example, Harrow Club have a youth club in South Fulham, but they also have the youth club in World's End. So it's quick time meetings, quick time information sharing with trusted partners. So it goes really well, but we're always continually expanding our reach. And, you know, for example, we're meeting with a new person from Ealing who wants to speak to us, who hasn't been ordinarily part of the information sharing meetings. So that's happening tomorrow. So it's always progressing and moving forward.
Thank you very much. Any further comments? Yes, Councillor Harvey.
Just some observations, really, not questions, but I just think the work that the team's been doing is really fantastic, and you can see that there's a real change and people's lives are turning around, which is really wonderful. I was actually at the Bush Theatre when you performed. I was sitting on the back. You probably don't remember me, but I was like, you should be at the table, and you should be at the table contributing and your voice being heard, and here you are, literally at this table. But that's when we also talked about the Young People's Action Group as well, and that being set up. So it's really, really fantastic to see you being an ambassador, and, you know, well done, just so amazing, really cool. And so the work you're doing with your young people and your community is just wonderful. And we need leaders like both of you in the community, bringing along people and helping them as well. So thank you so much for everything you're both doing. Thank you.
Thank you all very much. In that case, do members agree to note the report? Thank you very much. And again, thank you all for coming, to our officers, to Dominique and Said. Really grateful for you coming here and contributing, and for all the work you do, and really good to see you again, and hopefully we'll have you again soon to hear more successes. Right, which brings us to, well, the date of the next meeting. And do members note the date of the next meeting, which is on the 17th of June, 2025. Yep. Thank you. And that brings us to the end of the meeting. Many thanks.